Hi friends, today we are going to discuss about disaster management, practical tips for healthcare workers. Myself, Dr. Suresh Padambat, Professor of Psychiatry, Head of Forensic Psychiatry Services, Head of Telemedicine Center, Nimans, Bangalore. This presentation is only for academic purpose. This is not a guideline or a law or a substitute for professional opinion. Please contact respective and relevant field disaster experts. This presentation is based upon personal experience working in disaster and also relevant publication in the field of disaster. If you would like to have a legal opinion, please do contact an advocate. Disaster mental health and public health approach. This is one of the chapters which I have contributed to the international book. And also another book which has been published by Indian authors and Indian editors. This is a disaster mental health, a paradigm shift from curative to preventive psychiatry. Again, this is a book which has been published by CAB International, United Kingdom. This presentation is also based on my personal experience working in disaster. First disaster which I was able to work in tsunami, that is in Andaman Nicobar. The next I had an opportunity to work in Uttarakhand flash floods. With that background of working in disaster and publication and research, I will start with my first lesson. The number one is disaster survivors are normal people in abnormal situation. They are not mentally ill, they are not physically ill. They are basically the victim of disaster. Disasters are inevitable part of our life. We need to prepare ourselves, we need to respond and also mitigate the suffering. So these are the phases of disaster. As soon as the disaster strikes, the heroic phase steps in. During this heroic phase, people help each other, they donate, they collectively try to save the lives of human beings. And as soon within a 2 days to 3 days or a week, a honeymoon phase starts in where the help and relief work starts pouring in from various national and international agencies. The honeymoon phase lasts for 2 to 8 weeks. During this period, the survivors are kept in the camp. They have been given food. At the same time, VIPs, bureaucrats, media, and various people do come and also give various promises and also offer them job, and various activities do occur there. But as the end of 2 to 3 months down the line, this starts weaning out. So the survivors are left in the disillusionment. So that is the reason it is called as disillusionment phase. This disillusionment phase lasts very long. It is from 3 months to 3 years. After 3 years, restoration phase starts. The first question is, when should I enter the disaster zone? Heroic phase, or in the honeymoon phase, or in the disillusionment phase? So you being a healthcare worker, depending upon the requirement and the call, you can either enter in the heroic phase, honeymoon phase, or in the disillusionment phase. I would recommend for mental health professional to enter during disillusionment phase where the requirement is very high. The mental health morbidity is shown during the disillusionment phase. However, being a psychiatrist, you may either contribute during the heroic phase or in the honeymoon phase. However, before you enter, you should know basics ABCD of disaster zone. First and the foremost, when you enter into the disaster zone, do not expect VIP treatment. Do not expect for official delegation. Do not expect accommodation, transportation, food, etc. You are adding burden or a strain on the meager resources in the disaster community. You have gone as a volunteer to help them. So please do not cause strain on the meager resources available. And the team members of the healthcare workers should be very healthy. Before you go to the disaster zone, please check your health parameters. If you are healthy, then only enter into the disaster zone. Once the team formation is occurred, now is the time for networking. And after the networking, the work starts. First and the foremost, once we enter the disaster zone, start the needs assessment. Collect information from various sources. The first place to start is from the hospitals. Tertiary hospitals, district hospitals, community hospitals. Visit these hospitals, look where there is patients are kept in the ward, talk to them. Interact with the family members of the patients. Ask the survivors, collect information, know about the local geography, know the areas, know the culture, know the people, know the disaster impacted areas properly. After that, meet the local health department, officials, NGOs, where is the requirement of you. That has to be discussed and plan your work. So whenever you enter into the disaster zone, you need to go to various camps or various places. These camps are usually located in the schools or the colleges, or it may be even in the camps. The camps may be a temporary shelters which are kept in the open area. So first and foremost, when you enter into the camp, do talk to the camp leader or the camp manager. After that, go and interact with the doctor of the camp if he is available and discuss about the mental health issues and the any other requirement of the doctors. Then you start announcing the availability of doctors or the specialist in the camp. Do not label them as a mentally ill. The initially, if you are going in the morning, please do talk about announcing on substance use. Usually in the disaster camp, the substance use is very high because people have undergone disaster. They have been the survivors. The only way to learn coping is by drinking alcohol. So the early morning, starting with the substance use treatment clinic is very helpful. One of the main reason being is after by around 9:30 10, most of the men survivors start moving out in search of livelihood. So better to do treatment of substance abuse in the morning. After by the afternoon around 12 o'clock, plan for children. So when you do the announcement, talk about the symptoms, not the diagnosis. Say that if the child is crying or clinging or difficulty in walking, bedwetting or temper tantrums, please do come to the health clinic. That kind of announcement should be done. After this, in the afternoon, you can focus on women and geriatric population who are usually available in the afternoon. But please do remember, demedicalize the experience of the survivors. Do not unnecessarily label them with the diagnosis. Either it may be mental illness or a physical illness. Deprofessionalize the services. As many as people are going to help you do in the camp, please take their help. Do not expect only doctors will come and help. This is a disaster zone. You require support, help from whoever volunteers available in the camp. This is a camp which I had visited in Andaman Nicobar. This camp had huge number. Once we did a public announcement of the symptoms, not the diagnosis. We did not say that I am a psychiatrist or a mental health professional. We used to call like people who are having anxiety, who are having dizziness, who are finding it very difficult to sleep. Please do come for the clinic. Avoid mental illness label. Then the patients or the survivors do come for seeking help. The initial acute phase of the response and our work from NIMANS has been documented in International Review of Psychiatry. This is a publication which is published about tsunami and psychosocial aspects of Andaman Nicobar. That is in the early phase. This has been published in 2006. Once you know where are the camps located and you start going to the camp to provide healthcare, at the same time start parallel networking. Networking for capacity building and advocacy. This is a very important, mainly because bringing what we call it as local empowerment, preparing them to for the disillusionment phase. So parallel networking should start with school authorities, colleges, training the teachers, training the Anganwadi workers, education department, looking for camp authorities, training them, finding the volunteers within the camp to provide health safety measures and also looking for suicidal ideas. So please find the volunteers within the camp, educate them and allow them to go. They will bring the patient. At the same time, you also find various departments would have been affected very badly, especially in Andaman Nicobar. Electricity department was very badly hit because these were situated near the seashores. So we got a call from the electricity department for providing counseling. At the same time, we were also involved with the working with health department and various other departments also. This is a photograph of family counseling which we initiated on the request of the Electricity Department of Andaman Nicobar. At the same time, capacity building was done in various places. It may be in the education department, especially for the teachers, for early identification of children with mental illness. At the same time, we also started doing work in counseling and also trauma counseling with the nurses and ANMs. And also we visited various camps and volunteers were trained. And we as a healthcare workers joined together from various international agencies and published this. This is a psychosocial response to disaster and Asian perspective with regard to tsunami. Another very important point. If you are a disaster relief worker or a healthcare worker, never ever criticize disaster relief work in ground zero situation. The main reason is the people who are working, especially the administration in the disaster zone, they themselves are the survivors. They may react, they may respond, they may be very volatile. Don't go and criticize their work because they themselves and their family members are under tremendous stress. They may make mistakes here and there. Please do not criticize. The situation will be very, very volatile. Your criticism may provoke anger and there may be clashes and there may be fights. And many disaster zones, these are well documented. Please do not criticize disaster relief work at the ground zero. If you want to criticize, it has to be very, very gentle and it should be constructive, not destructive. Please never ever do this. Work with the administration because the unity and solidarity is the requirement of the hour, especially in disaster zone, that too especially in the ground zero situation. Coming to this, when you enter to the camp, please do understand the camp placement, how the camps are distributed in the disaster zone, how the people are placed in the camp. Invariably, the camps are located with related to religion, place, geography. Please do understand that. Please, when you enter into the camp, know where the women are kept in the camp, where are the places available for children to activities, and also please do liaison with the administration. Networking with the NGOs also will help, especially local NGOs. They are very, very helpful. At the same time, whenever you want to liaison with international agency, please do clear about what is their agenda. Once you know the international agency's agenda, it is easy to work with them. And also at the same time, you should know the camps do disintegrate and also repatriation of the refugees do occur very fast. So you should be very, very fluid and also flexible in your disaster work. And at the same time, displacement of the survivors plays do a huge role in disaster mental health. So whenever you look at these displaced survivors, please do give very important health component to them. Once you are working with the survivors, please do know there are some high risk population who develop mental illness. Who are those? The first and the foremost high risk population is the displaced population or the displaced survivors. In the disaster zone, invariably the populations will be displaced and they are kept in the various camps. So you should know who are the people who have been displaced. If there was a disaster has occurred and it appears to be safer now, and the people who would like to stay back, they should be allowed. Because the various research have found that the displaced population has higher mental health morbidity compared to undisplaced population. Again, the next important high risk population is children. You should learn to tackle and engage the children. Especially the children can be engaged in art therapy, storytelling, and various play activities. So please do plan for that. And we have published about the psychological impact of tsunami on children and adolescents from Andaman Nicobar Island. So when we did the art therapy, especially with the children who were not able to verbalize the trauma which they have undergone, when the art therapy was introduced, many of the children started doing diagrams or what we call it as the drawings. This drawing, when we asked them to explain, they were able to verbalize their emotions, verbalize the whole event easily. These are the diagrams which have been drawn by a young kid of 4 to 5 year old which saw the dead bodies floating in the water. And this is the diagram from the Uttarakhand. And we had able to report this psychosocial adversities experienced by children and adolescents in Uttarakhand 2013 disaster. At the same time, you should also know the women and the disabled people are at the high risk, especially these gender differences in psychological impact of any disaster. The, the women are hit very badly because the relief material do not reach the women. So we have to be, gender sensitivity has to be taken care. It not only in the placement of the camp, their privacy and also confidentiality has been lost. Finding a safe place for women during the disaster is a very big task. So our resources, whatever meager resources are there, we should use that to provide support and care for women, children, disabled and elderly population. Again, you could find many of these elderly population, many a time they do survive the disaster. They survive with a severe survivor's guilt, and it is very essential you should engage them and to normalize or validate their emotion of survivor's guilt. We have uh, published our research findings in American Journal of Geriatric Psychiatry, especially the psychological impact of tsunami on elderly survivors. This again focused more on the survivor's guilt. Invariably, during disaster, many of the geriatric population usually high mortality is seen, but if they are survived, they have a severe survivor guilt. So the mental health professional do have a high responsibility to provide care to them. Is there a role of psychiatrist? If so, then when? See, we have discussed this, the role of psychiatrists or mental health professionals in this publication, which was published in 2015. I request the audience to go through this publication so that you'll know, you'll get a comprehensive picture of what is the role of mental health professional during disaster. Mental health professionals have important role to play during the pre-disaster, disaster, and post-disaster. Their role starts from planning, prevention, curative, and also stress management of healthcare workers. Psychiatrists need to play important role during prevention, and also during the disaster, you need to work as a doctor. During the disillusionment phase, you need to work as a mental health professional. So their role starts from A to Z. So they have to be a important integrated part of the multidisciplinary team, from the preventive to the curative to the restoration plan team. So the mental health professional should be there from the planning to restoration phase. The preventive work which can be initiated before the disaster strike is teaching first aid, both medical or physical first aid and also psychological first aid. Basic steps of counseling should be taught to all volunteers, all college teachers, all school, what we call it as college students, so that they can provide the psychological first aid or the physical first aid whenever the disaster strike. Grief and trauma counseling can be taught to the psychological graduates so that they can be handy during the disaster. Identifying mental illness and referral should be taught to nurses, A&Ms, and various faith healers and the alternative complementary medicine people. Life skills training needs to be learned by the clinical psychologist and psychiatric social worker so they can be implemented immediately after the post-disaster. DMHP, that is District Mental Health Program or a National Mental Health Program, should be implemented at the earliest, because those teams available in various districts can play a crucial role in mitigation of disaster suffering. Stress management for the healthcare workers, that should be in place. Substance abuse and also substance abuse clinic or a de-addiction clinic should be available in each district so that whenever the disaster strikes, the supply chain for substance abuse or the substances is cut short. There will be severe withdrawal, especially alcohol or else other drugs. So during that time, the de-addiction clinics need to step up their care and provide care immediately after the disaster. Engaging children to normalize their life is also crucial, especially during the disaster, both in honeymoon phase and also during the disillusionment phase. Health of the team members. This is very essential. because you being a mental health professional, you should need to know how to take care of your physical health and also mental health. So work as a team. Do not fight. Infighting within the team causes severe stress. Debriefing should occur every evening. That means the whole team members should come back in the evening, sit together and discuss what happened today and what should they are going to plan for tomorrow. Keep a diary. Every healthcare worker should keep a diary and write their experiences. Please do carry required medicine for the survivors and also to the self. And the healthcare workers' physical health should be at the topmost. You should not become a victim again there. So please do find people who are physically fit to work in various conditions. It may be cold, it may be raining, it may be walking for many kilometers every day. It may be in a very uncomfortable terrain. So the healthcare workers should be ready for any kind of work in the disaster zone. In the disaster zone, there will be no structured day. The days are chaos, unorganized. If possible, please do make structured activity. Although if there is a structured activity, be flexible and fluid. There may be administration calling you for sudden movement from one place to another where the requirement of your healthcare professional is very high. So in between, please do take breaks. Every 5 days, 7 days, you have to take a break. Call it a day and then again start fresh on the next day. Please do take care of your health. At the same time, do not forget contacting your family members. Please tell them where you are, talk to them and give your updates. This is a very essential. And also keeping update with your family members and friends do help you in keeping your mental health calm and cool, relaxed. You being a healthcare worker, please be ready for strategic action. What is the strategic action? During the disaster zone, you are working in a health camp. There will be a visit of VIPs, politicians, bureaucrats, and policymakers. Please do engage them. Please do tell what are the problems in the health camp, what are the problems in the general population. Please keep write-up, printed material ready. Give it to the policymakers, politicians, and tell them this is the requirement of your population, the population under you, so that they take appropriate action to make relief. At the same time, please do remember there will be media accompanying them. So engage them. Do not give sensational information. Be prepared. Some important items or what we call it as important information to be coming in the media. Those information may be health education, counseling, providing, seeking help or what we call it as helplines availability. What are the do's and don'ts for the survivors can be printed in the media. So please do engage the media. Do not disengage them. At the same time, you being the healthcare worker, do not stay more than 4 to 8 weeks in a disaster zone. The team should replace. But however, one member in the team should be an anchor to help the next team so that the teamwork continues. And this is an example where we were able to engage a local newspaper and spread good healthy lifestyle during the disaster. And doing research is a very important in the disaster. But however, it may be seen as unethical. Unless you do research, you will not be able to plan, prevent and mitigate the disaster. So before the disaster strikes, please do take approval from the IRB, that is Institutional Review Board Ethics Committee, about your plan of doing research if there is a disaster occurs. So keep your protocols approved, informed consent ready, printed materials, documents, so that you execute the research plan as and when the disaster strikes. But however, your research should not get the priority over the humanitarian crisis need. So at that time, the research should do take a part of the disaster management. It should not become the whole disaster management. Research should be very small, but the relief work should be in the forefront. But however, planning for research is very essential in disaster zone so that we can have a evidence-based, what we call it as disaster management. These are some of the articles what we have published by our observation, collecting information in various disaster. This is from the Uttarakhand disaster where we collected the information and we submitted our research uh, outcome to the Government of India, where DMHP was implemented in various parts of Uttarakhand. At the same time, we also did a review of prophylactic requirement of psychotropic medication in disaster. Can we prevent mental illness post-disaster in survivor? By various international authors, we tried to do the review and found that using prophylactic psychotropic medication, we do not have any evidence and it is not justifiable. So please do engage in research so that you are going to build evidence for disaster management. Take home message. Survivors are normal people in abnormal situation. At the same time, you being a healthcare worker, please do take care of your physical health and mental health. When you are entering the zone, disaster zone, please take those people who are physically healthy and mentally healthy. If not, they themselves become the liability in the disaster zone. That should not happen. When you enter into the disaster zone, please do not expect any VIP treatment. You should be contributing for the disaster relief work. You should not create problem in the disaster zone. Never ever criticize the disaster administration work because they themselves are the survivors of the disaster. So please do work with the disaster administration, not against them. Please do engage policymakers, politicians, and the bureaucrats so that you can bring in change in the public health. At the same time, your disaster work should be empowering the local community. Basically, don't provide fish. Teach them how to fishing. So that will empower the local community so that they are ready for the next disaster and they are prepared how to take care of themselves and their community during the next disaster. Thank you very much. Please do subscribe to this channel if you want to have these kinds of video. At the same time, I request all the youngsters, be prepared, be ready to work for your nation when the disaster strikes.